Welcome to USTC360. I'm Ginger Chang. Our feature today focuses on a less publicized national health issue, America's broken dental care system. According to CBS News, a shocking 100 million Americans forgo dental insurance because it is too expensive. Putting off dental treatment not only leads to health problems and unemployment, but it can result in death too. To address the obscure health crisis, Tzu Chi's Medical Foundation have been serving the nation's vulnerable and underserved population since 1993. The CEO of Tzu Chi's Medical Foundation, Debra Boudreaux, is here today to tell us more about the foundation's great work. Welcome, Mrs. Boudreaux. So before we begin, you used to be a journalist. Then why did you get yourself involved in Tzu Chi's Medical Foundation?
I believe back to 20-some years ago, I spent my time at the Methodist Hospital emergency room.
Oh, wow.
So I started to do the volunteer works.
Right.
So my mom kept telling me, why you have to do that kind of work in the some kind of different faith-based hospital. There's a Buddhist organization also needs some help. So that time, Brother Stephen Huang and Dr. Chin-Lon Lin, they indicate they're going to have a clinic set up.
Right.
So they say, can you help? I say, okay, why not? So I just started to reach out to Tzu Chi organizations.
Well, let's go meet the care recipients who will tell us more about the desolation of being homeless with an unpleasant toothache.
It helps out the coalition, helps out, because there's an opinion about the homeless right now, and I'm getting really freaking tired of what the hell's going on there.
Yeah.
Most of the people that we deal with are what they call chronically homeless. They are people that have been homeless for a long period of time. And it's very difficult, once you've been homeless for a long period of time, to be able to get off the streets.
We can see people who has very high education. Some of them are PhD. Some of them are CEO before.
I studied computer sciences at UCLA in California, where I got my bachelor's degree. Went back, opened up a public relations firm, making about $6 grand a week, $50,000 bonus every 6 months, very comfortable. Corporate credit card, expense account, you name it.
I was making $1,200 a week as a truck driver. Pretty good job, really great boss. I've got 2 master's degrees, a couple bachelors, and a minor in history. Unfortunately, I never was able to practice the anthropology or archaeology that I was trained for.
Some of them are really up there. There's some really intelligent people out there, okay? These people are not stupid. They aren't retarded.
There's a certain percentage that suffer from mental illness. A certain percentage that suffer from alcoholism. A certain percentage that suffer from drug addiction or combinations of those things. And the longer they're on the streets, the more you tend to self-medicate.
A little bit, we have a little bit of ugliness to us. I'm from the 70s. Everybody was experimenting back in them days.
I got in a situation where there's a lot of drugs involved.
I was doing drugs and my father-in-law kicked us out. So that's why I became homeless.
Started getting involved with the drugs and the alcohol. I ended up losing everything, getting arrested, going to jail and prison.
And I said, Mom, forgive me. And she forgave me. And then it's hard. It's hard. She's my only thing I have. I don't have nothing else. Then there's somebody trying to get advances on me. Because of my past, like I told you before, I was a drug addict. I'm a drug addict. I'm working on it.
Get out of drugs and drinking and drugs and blah, blah, blah before. But now I got diabetes and my teeth are bad anyway.
It's kind of a depressing thing because we know that we're going to see these people until if they die on the street. We've had 3 of our people from our shelter this year that died on the streets already. 3.
A lot of people out in the streets are not around anymore. These are friends of mine, people I'm gonna miss, people that I know.
No, New York.
They all know New York.
You've been to New York? And many of them just drink themselves to death.
I have 60 days clean today. I'm working on my recovery. It's hard. It's really, really hard.
But I've been clean and sober for 30 days, and I'm trying to get my daughter back.
And you just learn to control it and don't let it control you.
And it's more difficult. They wanted to cut back our funding this year for a winter shelter program. The people who suffer, as soon as they start cutting, the government cuts back. The people that are going to be affected the most initially will be those on the low end of the economic scale. The poor people, the homeless people, the elderly people, all of those people that need a safety net, they're the first ones to be affected, which is really a crime. Let the rich get richer, and so the poor are going to suffer, but very important to let the rich get richer.
So many laws and stuff that are just contradicting each other, so you're never going to be able to, go ahead without assistance.
You can't ask people for money because it's illegal. I've gone to jail for it. Yeah, it's illegal to ask anybody for money.
Like in the 20s when they had the original Depression, you could make a campfire and cook stuff. You can't in the city. You can't make a fire and you can't cook anything. You can't stay warm because it's in the city and it's against the law. So I'm here digging in the trash can so I can get a room.
Us homeless people are harassed by the police just because we are homeless.
They write you a ticket, they can arrest you, they can do anything they want.
It gets frustrating. I mean, you wake up every day and you're back, I'm still here. It's not from lack of trying or determination or anything like that, because I'll put job applications in all the time. And whether it's because my teeth are messed up or how much worse can I get than to be sleeping behind a fucking garbage can where people take a dump, or to have a dirty blanket that keeps you warm at night because that's all you got.
1,000 years later, 20, 30 years later, you're still doing the same thing.
I've been homeless over 10 years and I'm still here.
There is no type of transitional housing for them. There's no opportunity for them to get into any kind of permanent housing.
And aside from a homeless shelter, there is no other place to go.
Of course, the winter shelter is the largest program that we have because we see so many people each night from December 1st through March 15th. Our average number this year will probably be 170 each night for 105 days. When they come, they receive, of course, a dinner.
Our menu is baked chicken and mushroom gravy, rice, white rice, corn, salad, and cupcakes.
So tonight we're starting service.
There's clothing available to them.
And it's the clothing that the other shelters don't really offer.
Like socks are golden, when you're on the streets. You gotta protect your feet.
We have the 6-unit shower unit that goes from church to church, so they have the ability to take a shower, which is very important to them. They're provided a cot and a blanket for them to stay the night.
So in the winter shelter, it's very cold during December, January, February, March. So it provides warmth.
One of the services we do provide is transportation. We lease 2 buses And those 2 buses make 6 stops. And of course, we have the Tzu Chi Foundation that provides the dental vehicle every Thursday and Friday. They're here. And also they provide haircuts.
It's been for more than 5 years we're working with the East San Gabriel Valley Homeless Association. And there's a huge homeless population really need to have a dental care. So 5 years ago, we have a chance to work with them and team up with them to spend from November 15 to March 15 every Thursday and Friday night to provide the dental services.
For that 3.5-month period, we have made their lives a lot more pleasant. They have a place to come, they're treated well. At least we have made their quality of life a lot better than it was.
Dental insurance is changing in America. The Affordable Care Act of 2010 allows states to phase in Medicaid coverage for people with incomes below 133% of the federal poverty level. This is beneficial, especially for the chronically homeless. Mrs. Boudreaux, can you tell us how does this new coverage affect our dental outreach program?
Honestly, it would not affect our services at all. Because when they go to that kind of dental care, they're still facing a long time to wait and limited service scope. So for the mobile dental outreach, for the population we serve right now, it will be getting more and more need.
Well, one interesting fact is that before the care recipient receives Tzu Chi services, they must agree to turn their life around, such as quitting alcohol, finding a job, and learning to help others.
There should be 2 nerve strands here and 1 strand there, but there's an extra here and it's missing there. From my experience, the homeless usually have horrible teeth.
I had to get a root canal, and it was really pain.
Lately, I just had 7 teeth pulled from the top.
I have some roots showing, and they're really painful.
A night grind too, and bear down on my teeth.
Gum disease, and that's why I lost a lot of teeth.
When I brush my teeth every now and then, I'll notice a little blood.
When you're on the streets, you're not getting any kind of medical care. You know, they can't afford medical care. They certainly can't afford to go to a dentist.
They usually don't have insurance, so they won't go to a dentist because they can't afford the fees.
Economy got difficult, so I had no job and no home. I became homeless, and so I lost focus in taking care of my teeth.
I can't afford to buy a gallon of gas a day, much less $800 to $1,200 to $2,000 or whatever a dentist is going to charge.
I have no coverage.
I don't have no insurance.
There's so many people dying for no reason or really being hurt or hurting because there's no insurance.
Now it's $150, same place, $150 a tooth to get it pulled. You know, so teeth are expensive. So.
While working in a dental mobile car, I saw a lot of cases. Most of the people said they had no money to see the dentists.
It's been about 2 to 3 years since my last checkup.
I would say about 2 years since I've been to the dentist.
When was the last time you went to the dentist?
About 10 years ago.
If we have 10 patients, every one of them can save about $150. So we help save about $1,500 every night.
They did a cleaning on my teeth. They pulled a wisdom tooth out, which was killing me because usually you got to pull it out with a pair of pliers and some whiskey. If you do like mouthwash, it helps kill the infection.
I'd get medieval. I'd take it out myself.
They were split open because I had never filled them my root canals. So I ended up pulling out myself.
I
try to pull it out myself.
He had said that he used battery acid, drop a battery acid on his nerve, and it killed his nerve. And I'm like, I'm surprised it didn't kill you.
Yeah, I cut my you know the braces? I cut it with a scissors. I started cutting myself.
So I started using super glue to keep them in. That's the truth. I used super glue, and it lasted for a while, and then you had to put more and more. And eventually, one day, I was eating a hamburger, I think it was, and I swallowed them.
So, I mean, I'll try just about anything, but as long as it's on this side of stupidity.
We don't have the luxury of being able to buy medications or first aid kit. You got to improvise, do what you got to do out there.
So they have to rely on organizations like the Tzu Chi Foundation coming to our shelter to provide them with what otherwise they could not get.
You know, free dental, I mean, that's amazing. That's definitely something that you don't find at the other shelters.
If there was no dental, I'll be still crying in pain.
So they don't have transportation and they don't feel comfortable to our clinics. That's the reason why we reach out to them.
The fact that you have your mobile van that comes to where they are is really critically important to them.
A lot of them can't afford to see the dentist, so having the dental mobile car is very important because it helps a lot of the people.
Give us homeless people a better chance or an opportunity.
The therapy and the stuff I'm getting from you guys and the dentistry, I'll work it out, you know.
A whole lot better. It's helped me out a lot.
Oh, this is excellent. This is an awesome service you guys have.
Service is great. It's excellent. Where else can you go where you can get a dental service? Period. You know, at no charge. It's a blessing.
You have to brush your teeth. See, put up there because the A here, because the A here. Now this one is a bit bigger.
And so they really helped me. Yeah, we're really thankful. Even the dentist got a hug for me, and that's like weird. I know, who hugs a dentist?
This is only from 10. Okay. Look here. Okay. Don't worry. Yeah. Okay. Thank you.
We need help, but we're going to survive. We'll live in the trash cans like we're doing now, and with help from people. Some people are helping us. I hope I get my teeth. I'm really looking forward to getting some teeth again. And I don't know what to say after that. I'm kind of like getting shy now. And I gotta get my cans, come on.
We provide the transportation directly to their site. We interact with them. We care for them.
Welcome back. So, Mrs. Boudreaux, I understand in the long run you wish to implement preventative care programs. Then how can this be done?
Well, what we are doing right now, we already get into the preventive education. The preventive education including oral hygiene education. The other program we are promoted right now is the obesity program.
Okay.
The obesity program is like we eating a rice bowl. If you can manage your appetite to only 80%,
Okay.
and then consider to use those 20%, either save the money or reserve that 20% to do a good deed.
Well, Mrs. Boudreaux, thank you very much for coming onto the show. It was a pleasure having you.
It's my pleasure to be here today, and thank you very much.
In our next segment, Footprints, we introduce you to Dr. Chris Liu, a dentist in Irvine who never hesitates to offer his expertise at Tzu Chi's mobile dental outreach program.
You know, the joy from the people receiving the gift card, they were crying, they just hugged the Tzu Chi volunteer, and that really touched my heart.
Since the Hurricane Katrina medical outreach in 2006, Dr. Chris Liu and his wife alone had donated more than $90,000 to Tzu Chi. In the meantime, Dr. Liu has been practicing his dental service in Irvine, California. Aside from his regular work at the office, he constantly volunteers in dental mobile outreach with expertise and compassion.
My first experience with the Tzu Chi back in 2003, that was Mexico outreach. I would just go there, do some dental work, and then come home. When I got there, and all the Tzu Chi volunteer brother and sister, they was so eager to tell me about Tzu Chi, and also the way they work as a group, that really, really impressed me. Because everybody was so efficient, and everybody is always working with a smile. Before I start Tzu Chi, I just want to do dentistry. I don't really care what the patients say, what they think. I just want to get on and do the dentistry and go on to do the next procedure. So, but after volunteering with Tzu Chi, it made me want to understand patient background. I want to find out why they're here. I'm sure there's anything happened for a reason. After volunteer with Tzu Chi for past 9 years, to give is like to receive, and serve and care with compassion.
Dr. Liu says besides being able to feel the sincerity and happiness from the patients every time, he is amazed by Tzu Chi volunteers' ability to have all the dental equipment set up within 30 minutes. I'm Ginger Chang, thank you, and I'll see you next week.